And this is like the other topic for this week. And the parasite we are going to discuss now is called as Ascaris lumbricoides. So again, a small introduction about this thing. So guys, this one is also called as ascariasis. Ascariasis. Now, ascariasis is a soil transmitted infection. It's a soil transmitted infection. Now, this is the most common human helmintic infection or human parasitic infection. Now, uh, okay, so uh, Ascaris lumbricoides, which is also called as ascariasis. Okay, so the first thing, it's soil transmitted, and the most common human helmintic infection. Okay, so now according to one estimate, they say that 1.5 billion people are infected. Okay, so see how common it is. It is around 1/4 of the world population. So the this condition ascariasis is caused by Ascaris lumbricoides. So it's a roundworm. It's an intestinal roundworm, and it is also, you can say, the largest nematode to infect humans. Okay. The adult worm lives in the small intestine and can grow up to the length up to 30 centimeters. So see how long it is. And the females are larger than males. And now people who are living in lower socioeconomic status or personal hygiene, sewage system, and all these things play too much role in the infection or getting infection by this thing. But most of the infections basically they don't cause any signs and symptoms, so that's why they're like they go undiagnosed. Okay. Children basically they are the one. Children they tend to suffer the highest worm burden. Okay. Now, like to tell you about how they looks like. You can see over here. This is like they collected a lot of Ascaris lumbricoides in a jar, and how the worm looks like. You can see the male and the female. They are shown over here. Okay, and they are round worms. They are cylindrical shape. They have tapering ends. You can see tapering ends, right? So the males are smaller than females. Okay, but even the male can be up to 30 centimeters, and whereas the female, they are the large one. They can go up to 40 centimeter, and they have vulva. So vulvar waist. Okay, so this is called as vulvar waist. Okay, and they have like this. Okay, they are showing you like how the ends look like. So they have the anal opening, they have the papilla, they have ventral lips, they have two ventral lips and one dorsal lip, right? So this is how they look like. And if you will see the eggs, The eggs are basically two types. You can see types of Ascaris eggs found in stools. A is the fertilized egg. Okay, so this is the outer mammillary coat. B is the also the fertilized egg. Okay, and C is decorticated fertilized egg, and D is an unfertilized egg, which is elongated with atrophic ovum. So this is how the eggs look like, and again, like I will show you the eggs. See, unfertilized egg and a fertilized egg, right? This is how they are they are seen. So you can see the fertilized egg here. They are round or oval in shape. Okay, and uh, basically they are always bile stained. This one. Okay, but one of the difference between these two is what? Uh, if you will take a saturated salt solution, fertilized eggs they float in that solution, but this one sinks down. This one does not float. Okay, this is the difference. Now, uh, there are many factors which define like who will get this Ascaris lumbricoides infection. The females they produce a lot of eggs, okay, and the eggs are quite, you can say, um, resilient or strong, like they can survive the unfavorable conditions. Okay, the eggs can even survive in the absence of oxygen, and they can live for 2 years at 5 to 10 degrees centigrade. So eggs can survive for up to 2 years, even in unfavorable conditions. Okay, so that's the reason this thing is important. Without oxygen, the temperature very low, they can still survive. Okay, so in favorable conditions, for example, moist environment, soil is there, eggs can survive for 6 years. So see, it's a quite long survival. Okay. So now the highest number of these infections occur in the tropical regions. Okay, and what happens is like simply the infections can occur around the year. So now this infection Ascaris is like transmitted by ingestion of the contaminated food or water. Okay, so this is like one of the photograph I took from my Indian book, and this one is taken from CDC. So you can see like the infective stage, and you can see the diagnostic stage. So what happens is that this one can be ingested by contaminated food or water. Okay, so the infection can occur in any age group, but it does mostly occur in the young children. Okay, so a very big factor is contaminated soil or contaminated water, simply. So now what happens is the adult one, you can see number one over here. The adult Ascaris form reside in the small intestine. See, this one resides in the small intestine. So where they get their feed from the food you eat, they eat that food. Okay, and they can live in the small intestine for up to 10 months to 24 months, and These adult worms are covered with a tough shell composed of collagen and lipids. So now, what happened? Uh, uh, like the shell which is on these adult worms, okay, they protect them from digestion, from the intestinal enzymes like hydrolysis. Why? Because these shells, they keep on producing protease inhibitors which prevent the digestion of this worm. And now this adult female, which is shown over here, they can produce up to 200,000 eggs per day. Okay, 200,000 eggs per day. So the eggs that pass out of the adult worm, they are fertilized eggs. Okay, so now once these eggs, they are released from the feces, okay, so they reach the soil. So see, number second is unfertilized eggs. So this one will not undergo further development, but the second one is the fertilized egg. Okay, so now what happens uh, when these eggs will reach the soil? So the first stage larva develop into the second stage larva. Okay, so this is what occur. So this second stage larva, when it is going to develop, it is going to hatch. Okay, it is going to, like, the second stage larva is going to hatch by the presence of alkaline conditions. Okay, so what will happen that uh, they are going to hatch. See, the hatch larva enter circulation and migrate to lungs. Okay, so this thing can also occur. So this larva can penetrate the uh, like the small larva can penetrate the intestinal wall, and can go to the enter into the portal circulation, can go to the liver, and from the liver it will enter into the inferior vena cava, will go to the heart, right side of the heart, and from right atrium to right ventricle, it can reach the lungs. Okay, so simply this larva can travel from the intestines to the pulmonary circulation. Okay, now the larva in the lungs are going to change its shape. Okay, and they break into the alveoli of the lungs, and then the same story, they will pass through the bronchus to the trachea. Okay, and then again they will be swallowed back into the GIT, and again, the same cycle will start again, right? So this is how this thing functions, or this is the life cycle of Ascaris lumbricoides. So you can see over here, ingestion is there, and what's going on. Okay, so once, it will reach the intestine, it is going to pierce that, reach the lungs, and again will be digested back into the intestines. So what are the clinical manifestations or the clinical features of this condition? Okay, so the clinical features of Ascaris lumbricoides, it's a very widely present infection. Okay, so now most of the people who have this Ascaris lumbricoides infection, they are asymptomatic. Okay, so uh, what happens uh, whenever there is symptoms, they occur due to uh, larva migration. Okay, so simply when it is about larva migration, so remember there will be pulmonary stage. Okay, there will be intestinal stage. Okay, like, because they, so when it reaches the lungs, what happens is like the symptoms, they develop like how much larvas are there. Okay. For example, if the larva burden is too much high, so the symptoms will be more pronounced. But if the larvae are very less, so maybe the person will be asymptomatic. Okay. Basically, what happens, like we call it as the pulmonary stage, or when it is transferring through the lungs, we call that thing as transpulmonary migration. Okay. So, transpulmonary migration is responsible for development of eosinophilia, eosinophilia, or eosinophilic pneumonitis. Okay. So basically, if you when you will go in when you will study internal medicine, you are going to study a syndrome called as Loeffler syndrome. Okay. So Loeffler syndrome, what is Loeffler syndrome? Basically, there is pneumonitis with peripheral eosinophilia. Okay. So what happens, like in Loeffler syndrome, there will be like these are the patients who have eosinophilia with elevated IgE concentration. We call it as Loeffler syndrome. So basically, the symptoms they start occurring around after 9 to 12 days after ingestion of the eggs, while the larva reaches the lungs. And the affected individuals they often develop things like bronchospasm, dyspnea, wheezing, okay, things like this. Fever can be there, of course, okay. Cough can be there, like all the things, all the symptoms related to the respiratory system. Uh, okay, now the patients can lead to hepatomegaly as well. Okay, so this is like how when this thing occurs in the stay reach the pulmonary or the lungs, these are the things the patient present with. Okay, now it's very hard to diagnose this condition. Why? Because see, whenever someone presents with Ascaris related pneumonitis, for example, so we will do a chest X-ray, and the chest X-ray are usually clear. Okay, but sometimes we can see like some bilateral diffuse infiltrates, but most of the time it is clear. Okay, basically, the most bad manifestation or clinical manifestation of this infection is intestinal obstruction, because the burden of that larva is too much. Like it can block the intestines, it can block the lumen. Okay, so when too much worms are present, they can block the small intestine, especially in children. So they can present with the symptoms of intestinal obstruction. So how they present in surgery, you will study about this thing: nausea, vomiting, okay, as well as abdominal uh, abdominal pain, okay, distension, things like this. And the larva can be passed in their stools or can be passed in the vomits, okay, of these patients. So now the areas where this infection is too much, many times intestinal obstruction patients they present with this infection. Sometimes this parasite can also pierce the intestinal wall and can lead to peritonitis. Okay, peritonitis. Also, there are cases of hepatomegaly, which are also hepatomegaly are also reported in many of the places. Okay, so this is like what are the clinical features now, guys? The children who have too much worms in their intestine. So I told you from where they take their feed. They take their feed from the food you eat, right? So that's why the children who have this infection, they have impaired digestion, they have impaired absorption of proteins. So the children they present with stunted growth, and you can say like developmental problems, right? So that's why it's important to treat the children who have this infection so that they can grow normally. Okay, and many of the children who have infection with this organism, of course, like, or this parasite, they are also uh, have co-infection with other parasites as well. Okay, or other type of parasites as well. Okay, now some of the patients, they do present with hepatobiliary and pancreatic symptoms. Okay, not like too many, but there are cases who have like these type of things are reported. So simply, when this ascariasis or Ascaris lumbricoides, it migrate into the biliary tract. Okay, they can present with hepatobiliary and pancreatic system. So the patient, they present with biliary colic, okay, pain, as well as jaundice, okay, as well as ascending cholangitis. I'm sure like many of things you don't know, but like you will study these things and you would know. Okay, so even pancreatitis can develop, in these patients. So hepatic abscesses are also reported. Okay, abscesses are also reported. Okay, in many of the areas of this world. Okay, so how we diagnose these patients? Diagnosis. So diagnosis is made through microscopic examination of the stool. Okay. So the eggs are very easily recognized. Okay. But if there is two less eggs are present, so diagnosis can be missed. But most of the time, they produce a large amount of eggs. I told you 200,000 per day. Okay. Sometimes, they use methods to concentrate the specimen, okay, of the stool. So of course, like, stool microscopy can be done. Sometimes, you can say an adult worm is passed through the rectum, okay, and they can be seen. You can do CBC, eosinophilia can be there, okay, and even sometimes a plain X-ray abdomen can reveal a mass of worms. Okay, so like these are few of the techniques by which this organism can be diagnosed easily, right? So simply we have to detect the parasite. We can detect their eggs, we can detect their larva, we can detect their what you can say adult one. And to talk about the antibodies, ELISA, IHA, okay, uh, are used to detect antibodies, mostly in extra-intestinal um, as- ascariasis. Okay, so these things can be used. Okay, treatment. Now the treatment is again the same drugs. Mebendazole, albendazole. Okay, they are very effective therapies for this ascariasis, and mebendazole can be given for 3 days or as a single dose. Albendazole can be given as a single dose. Sometime a repeated dose can be given after some time. Okay, one of the drug which is also an alternative drug which can be used is piperazine citrate. Okay, but this is not widely available. Albendazole and mebendazole are present everywhere. They are available everywhere. Okay. Again, the same drug which I was talking in the previous lecture, pyrentyl pamoate, can be given as a single dose. So these medications are all active against the adult forms, but they are not effective against the larva stage. So that's why a repeat dose can be given. Okay. Now, prevention of this condition is prevention can be done uh, by global deworming the school children. Okay, of course, like to kill all the worms they have. Okay, so this is like all the things which we can do. So that's all, guys, for ascariasis, and thank you so much for listening. I'll see you next week.